Okay, our next is proclaiming National Minority Health Month. And I think it's maybe one of the first times that we've done this. So we're maybe overdue, but you start where you start. And thank you. We have on our floor, we have a great advocate for National Minority Health Month. Happens to be my executive assistant, Ron Wells. Stand up, Ron. Ron is certainly keeps the awareness on the eighth floor of the need of the minority community for health that's different than the rest of the community, as most things are to do this. So thank you, Ron. These things are getting here because of your work, and thank you for bringing us our awareness. We have the health department represented. Hey, we got the new leader, and hello, Shannon. You're our constant there, but I think it makes a real difference if people understand what Minority Health Month is. It's just not a phrase. These are again just there's a theme of our proclamations today. Lives are at stake everywhere. We're gonna get to 911 next, but you saw awareness of work zone awareness. We need to be awareness of the disparity of healthcare in the minority community. That's just not a talking point. That's a fact. That's data driven, and the lifespans are different. Incidences of diseases are higher. Things like diabetes, obesity, the things that inflict all of our society is especially impacted in our minority health community to do that. So for us to take a few minutes to focus on that, I think is work worth doing. And this is April. It was 1915. It was the establishment of National Negro Health Week by Booker T. Washington, the Office of Minority Health within the U.S. Department of Health and Human Services. Oh, there goes Fleetwood's guys already working. All right. So it's over 100 years old that people have had some awareness. The health department, CareNet and others, you're our conduit to healthcare, but to the minority community lots of times. So thank you for being here, because it takes all the stakeholders to get this message out, that there is a disparity. We can lots of problems are solvable, right? This is another one that's solvable. It's diagnostic pre-testing. It's integration of people having a connection with the healthcare system somewhere, whether it be the health department, your private physician, the hospitals. We can be aware of the minority health issues and disparity, but the solution is getting people connected. We can admire the problem. How do we fix the problem? And I think that's the job that we're going to hear about a little bit today. So thank you, Ron, Health Department leadership for coming and helping us proclaim April 2024 as National Minority Health Month in Lucas County.
And we also saw the disparities, excuse me, I can't speak this morning, really in COVID as well. COVID really brought a lot of this to the forefront. I think we all knew about it, disparities, but when COVID happened, we really saw, and we're really seeing how Local 500 is really working today. But we also must, across the board, look at infant mortality, hypertension, and really you name it, there's a disparity within that. We also must, so we must, across the board, look at what we can do to just really hone in on this and correct the disparities. And I think that our health department is really chipping away, but it takes a lot of chipping because it's going on for a long time. Access is an issue. And I know we have a number of organizations here that have done a tremendous job reaching out to the community to meet them where they are at. Our health department has done this. They work, Robin with ProMedica, who I know has engaged with many initiatives, including barbershop initiatives, where barbers would have connect residents to blood pressure tests and many more. These are great things that are happening in our community. There's a lot more work that needs to be done. But I think we're committed as a Board of County Commissioners to work beside the health department, to work beside those in the medical fields, to close these gaps when we talk about these disparities.
And I just would like to say that I think it's so important that we reach out to and partner with the community organizations. There is a I think as a Hispanic young lady growing up in South End, having a community center and a clinic that was right across the street that provided, which was diverse. Like the first time I ever saw a Hispanic nurse. And back in those days, they wore the white outfit still. Just tells you how old I am. But partnering with those community centers in areas of diversity is so important. And the outreach that occurred during COVID was exceptionally well put together with the movement and other community organizations. So if we can continue to work in building those alliances with the community organizations that are out there, because the traditional healthcare still, it may be intimidating to individuals, may have transportation issues, may have language barrier issues, or just historical cultural issues of where individuals sought medical treatment and unfortunately were treated differently and tested differently. So there's still improvement that can be made, but I just am very grateful for what I've seen to date and what I've experienced in my life. So again, thank you to Shannon, who helping us through the transition, who was here during COVID, and welcome. I think we also have other representatives, Amy Hurley, Holly Papada, and Crystal Martin. And then is Robin Charney present? Okay, great. I just wanted to make sure we recognize the hospital council also.
All right. I think if you don't mind, if Ron, if you want to come and say a few words on this, you've helped educate us as a policy board. Ron is a doctoral student in public health, and then please some contributions from our health department leadership too. Thank you. You know the rules, all right?
Thank you for, I'll keep it short since I really just want to hear from the hospital council, the health department. Really, they're the ones that are, kind of the vanguard, the tip of the spear, so to speak, on these programs that work toward really addressing health disparities. And I think that, what we see from the science and from the research, when we focus on health disparities, really we're putting ourselves in a position to ensure health for all of our citizens, right? Focusing on the most vulnerable, typically those in between are, can benefit from those initiatives and programs as well. And so I just thank the commissioners for recognizing this. We have to continue to educate our citizens and empower the voices of those doing the work. So I would love for the health department, the hospital council to just speak about the programs that do exist here in Lucas County.
Love to hear it.
Good morning, and thank you, commissioners. I just want to take a minute here before we start introducing myself. I'm your new public servant, serving in the capacity of public health commissioner. A lot of that work on improving minority health in Toledo and Lucas County has been done. It's been ongoing, and a lot of it I cannot take credit for. It's the team who did all that. I'm going to let Shannon talk a little bit about that. But this is a commitment from, the commissioners and your public health department to work diligently on improving minority health. To us, this is public health. This is elevating the whole population where we need to be. Commissioner Sabaki was right about COVID, exposing some of those disparities and, showing us the gaps, and our commitment on that proclamation day that we're going to work diligently on that. So Shannon, please talk to us a little bit about the initiatives you guys have been working hard on. Thank you.
Shannon, before you start, I want to take this minute to think about COVID, because we all forgot about COVID kind of now. We shouldn't ever know what happened there. And I want to take a minute to recognize the people in this room from the hospital council, and especially you, Shannon, personally, our executive assistants at the time that were here, that spent hours and days and weeks in a bunker, literally inside a bunker, at our response building, our 911 building. And that's work that never got seen, but was critical for our community surviving COVID. So people like Shannon and Ron and others, health hospital council, you were in that hole trying to figure out policies on the fly. Mm-hmm. So I want to take a minute to recognize your work and theirs work to do it. And I think we owe a round of applause.
Thank you. Thank you to Commissioner's Office for acknowledging and raising awareness on minority health in our community. I am actually here today on behalf of our Minority Health Coordinator, Cheyenne Narwat, who had an unexpected personal emergency, so I'm going to try to share her sentiments as best as I possibly can with you all. We actually, at the Health Department, were one of the 6 local offices across the state of Ohio to be established as a local office. Toledo was one, Akron, Columbus, Cincinnati, etc. And the overall goal of that office and what currently is to engage citizens in the process of eliminating racial and ethnic health disparities. And we are doing our best in that capacity. We have 3 different grants right now through the health department. We actually are getting 2 new initiatives through asthma and then also through opioid prevention that we will be implementing within the next couple of months. So there is a lot of work around our minority populations within our community, expanding the services that are available, linking individuals to the resources that are needed. That is really what our job is at the health department. We don't have necessarily a specific service or product that we're selling in the minority arena per se. We are trying to connect people to the services that they need and meeting them where they are. We haven't built the health department. We are going out in the community, reading and meeting these people right where they are in their own communities. So every April, we celebrate Minority Health Month as it's a critical time to address the significant health disparities that affect the racial and ethnic minority populations. We just kicked off our, we just had our kickoff event last week for this month and looking to do another event this coming Saturday at the Wayman Palmer YMCA for Healthy Kids Day, and that is Saturday, April 20th from 11 a.m. to 2. We want to shine a little bit of importance on the capacity to spotlight the unique health challenges and the barriers in healthcare access that these minority populations do encounter, which we know often results in higher rates of chronic diseases, a lower life expectancy, and poorer health outcomes compared to our general population. We encourage our healthcare providers, policymakers, community leaders, and individuals to engage in these activities that promote healthy lifestyles, preventive care, and disease management among the minority communities. So by raising awareness and educating our public, Minority Health Month aims to reduce stigma and eliminate barriers to health and wellness for all of these groups. The Minority Health Month serves as an opportunity to celebrate the progress made in reducing these barriers while also recognizing the work that still needs to be done. This encourages collaboration among our diverse stakeholders to develop and implement strategies that do address the root causes of health inequities. Through research, policy changes, increased access, our community outreach, and culturally competent care, the goal of Minority Health Month, in addition to our local office goals, is to achieve a future where everyone, regardless of race or ethnicity, has the opportunity to live a healthy, fulfilling life. So with that being said, thank you.
Hospital Council. Good morning. Good afternoon.
I was going to say that too. I was going to say good morning. I thought, no, I think it's afternoon. But good afternoon. I'm Amy Hurley. I am the director of the Northwest Ohio Pathways Hub, and I brought with me Crystal Martin today, who's the coordinator for our Queens Village program, and she will talk a little bit about that. So we want to thank the commissioners also on behalf of this and creating the minority health awareness. We started this process back in 2007 with one community health worker and one organization. And we've grown now to 18 partnering agencies that house community health workers. And we have a total of about 50 community health workers across 7 counties in Northwest Ohio. So we recognize we have long inroads to go. Minority health and disparities and inequities still exist, as does infant mortality. Black infant mortality is 3 times that of white infant mortality. So we really appreciate the acknowledgement. And we see in the rooms many of our community partners today. And so that's kind of what it takes. It takes a community to address this issue. So we want to thank all of our funders, the Ohio Commission on Minority Health, the Ohio Department of Medicaid, the Ohio Department of Health, and United Way. There are so many different entities who support this mission, and we would be remiss if we didn't acknowledge that as well. So I do want to introduce Crystal, who can talk to you about our Queens Village program and some of the events that we have coming up.
Good morning, afternoon, Chris.
Hello. Thank you so much for having me. In 2021, the Northwest Ohio Pathways Hub actually brought the Queens Village model to Toledo. Queens Village started in Cincinnati in 2018, and Queens Village was created to reduce the infant mortality rate, but is a very unique way to do so. So Queens Village, we reduced the infant mortality rate by providing stress relieving activities and events. And we really built a village of support around women before, during, and after pregnancy. We see that stress relief actually leads to premature birth, and premature birth in Lucas County is actually the highest cause of infant mortality is premature birth. So we try to address that. We have many different stress relieving events like fitness classes. We have we just recently had a wellness retreat, and this retreat was for pregnant mamas only. And basically they had the opportunity to speak to a Black labor and delivery nurse and a Black mental health provider to really get their questions answered about pregnancy and childbirth, and really to decrease just like their anxiety about giving birth, and also provide that education, but also provide them with different ways that they can advocate for themselves in healthcare spaces, because infant mortality really affects Black women at 3 times the rate, despite socioeconomic status, despite education level. So so that's what we're doing now, and we have one more event coming up on April 27th at the Frederick Douglass Center, and it's called the Infant and Maternal Safety Summit. And this safety summit will bring together, like Amy said, like this is a very collaborative approach. So we bring together, we'll have doulas, we'll have different community parent support groups. We'll also have a labor and delivery nurse, a Black pediatrician, just to help the community really to ask those questions in a non-judgmental zone. So that's our heart here at Queens Village. And we also do our Sister Circles one time a month. And Sister Circles is our support group. We don't call it that, but it's a support group, and that's what it feels like. Well, it doesn't feel like that, but that's what it kind of is. Sorry. But we come together and we talk about like the real issues that we go through in our communities. But at the end of Sister Circles, we just can take a breather. Like we can come in and take our armor off and just be Black women. We don't have to wear the different titles, but we can take everything off and just really stress relief and really reduce the effect that stress has on our bodies, as we prepare for our babies and healthy births, healthy birth outcomes. So thank you so much.
Thank you.